you transition into not just understanding what health conditions are, but how to really understand in depth and use your clinical judgment and ensure in order to give safe and effective patient care. So this is an outline of the Tanner clinical judgment model. And this concept is used in the next-gen Nclex. So this is the model that the next-gen Nclex is pretty much based on, and that's how the questions will be delivered. We're not talking about those questions today. We will talk about certain multiple choice scenarios and go over that. But I always like to just bring this out just as a reminder that the next gen is not this big scary test. It's something that you need to develop over time throughout your studying, and just keep in mind the clinical judgment model. So this model can be utilized by both the novice and the experienced nurse, and allows for complex thinking that's required to take care of the patient. Not going to spend too much time on this, but there are certain steps in this, and one is noticing, interpreting, responding, and reflecting. And I'm hoping that we can touch base with that on the questions as we go through today. So let's start with medication scenarios. What I want to just remind you, thank you for all that are on our Zoom meeting today. And if you have any questions, please feel free. The goal is for this to be a session where we answer questions and go through and work together as a work group. So let's talk about case study 1, medication scenarios. Your patient is in the hospital for exacerbation of a chronic kidney disease. Her morning vitals are heart rate is 87, blood pressure is 172/90, respiratory rate is 15, the temp is 98.3. She's scheduled to receive antihypertensive medications this morning. The patient is scheduled for hemodialysis in an hour. So there are a couple things that we want to consider. So as we look at the options, what are our options? So these options are, we're going to be talking about, we're going to give, hold, call the doctor, call the pharmacist, or other we can discuss. So you're going to want to either give the antihypertensive medication, or hold the medication, or call the doctor, or call the pharmacist. So before we go ahead and answer this question, there are several steps that you should take when you're answering any question, regardless of how easy it may be. Of course, if you know the answer right away, then you're going to want to go ahead and select the answer. But when you're thinking through questions, it's always good to have a method of how you do it, so that you can answer them effectively in the same way each time. So what do we know about this? So what is the mechanism of action for antihypertensives? What do we know? So this is where, when you study your drug, or you create a drug card for your medications, knowing the class of medications helps. So we would plug antihypertensives into that category. As we're thinking about the answer, you will want to think about the worst case scenario. So if the patient takes the medications, then what will happen? What's the worst case scenario for this? So antihypertensive, as we think through this, antihypertensive medications before dialysis, they can cause hypertension. But some studies say to take them to avoid cardiac arrhythmias. So what you're going to want to do, so let's talk about the answers. So what you're going to want to do is, we're going to hold this medication. So so let's look at the other answer, was call a doctor. On the Nclex, they're not asking we're not asking what we're eventually going to do. We want to know, what is the first step that we do with this? So we're going to hold the medication, and then of course we would call the doctor to confirm and follow up, to ask the nephrologist or something like that, to see if there's any contraindications with holding the medication. But the first thing you want to do is hold the medication. You don't want to give the medication. So that's what they're asking you. So don't read into it that, okay, I'm going to hold the medication and call the doctor and so on. That was not part of this question. The question was, what are you going to do? And that's hold the medication.